The Fellowship of the Great Physician welcomes you to House Call. Our Dr. Chiropractic, Dr. John Dr. Jensen, who is also a certified acupuncturist, practice independently in Phoenix, that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Lala,
I'm Dr. Richard Jensen.
and as it says on the screen, here we're going to talk about some natural things that you can do to prevent cancer of the breast, prostate, skin, and colon. There is, in fact, no need to have cancer. When you have, we're going to talk about the first chemical right off the bat, calcium diglucarate. That is not a commercial name. It is a scientific name. What is calcium diglucarate? What is that, Dr. Lala? It is a natural calcium salt. We're not talking about the calcium you take to prevent osteoporosis or osteopenia now. It's a natural calcium salt that contains detoxifying and anti-carcinogenic agents. Now, where can you find calcium diglucarate? Where is it found? It's found in fruits and vegetables. It's found in oranges, apples, grapefruits, and cruciferous vegetables, and they include broccoli, cauliflower, etc. What does calcium diglucarate do? It is designed to inhibit what we call beta-glucuronidase. That's a real good word, isn't it, Dr. Jensen? So Dr. Jensen is going to discuss that chemical now and see if he can pronounce it better than me. I know what it does. That's what matters.
There we go. Well, let's try this. What is bad about beta-glucuronidase?
Wonderful.
Thank you.
You get a gold star.
Thank you. Thank you. It is an enzyme produced by organisms in the colon and flora that are involved in phase 2 liver detoxification. If it accumulates in the blood, it predisposes the body to breast, prostate, and liver cancer.
And so the flora that you're talking about are the intestinal flora, the good bacteria within our within our small intestine, right?
Well, those are the bad ones that make that.
Okay.
So that's when we're talking about not eubiosis, but dysbiosis, where you have bad bacteria.
Right.
So how do we determine its presence? Well, we do that through two means, the organic acid profile and a chemical scan. One of the categories in evaluating in the organic acid profile are toxicants and detoxification. And one of the markers evaluated in that section is glucarate, a compound of potentially deleterious enzyme beta-glucuronidase, which is a precursor to the development of cancer in the breasts, prostate, and colon. So then,
I certainly, if I wanted to prevent cancer or if I had cancer, I certainly would want to have that organic acid analysis plus a blood scan, right?
Certainly. One is it gives you a great basis for the nutrition that you should have.
It's incredible the people that want to live long life and good health and want to be free of cancer, or the people who have been diagnosed with cancer who are so underdiagnosed.
Mm-hmm.
Okay?
Definitely. Well, if you look at it, we always have cancer in our bodies. Always. Everybody. You and I and everybody else. But what happens is our immune system helps to get rid of those cancer cells beforehand. It's when we find that there is a buildup of those cells and a deficiency in our immune reaction that this can get out of hand and proliferate through the body to the point where it becomes an emergency. And so in that regard, it's prudent for us to check these chemicals so that we can bring the body back into the balance and help it with that immune response or decreasing the cancer before it becomes a problem and becomes diagnosed cancer.
Right. Well, that's now we can talk a little bit more about calcium diglucarate. We'll bring it up on the screen enough that you can mark it down. What are some of the potential effects of calcium diglucarate? It lowers cholesterol, and it regulates estrogen metabolism. Now, why would that be important? If estrogens are elevated, women then are predisposed to breast and ovarian and uterine cancer. So we'd want to keep those estrogens down, and calcium glucarate certainly plays an important role in doing that. Now, Dr. Jensen is going to talk about pharmacokinetics.
Thank you, Dr. Lala. So pharmacokinetics, the importance of let's bring that back, the importance of a proper acid stomach where its pH is about 5.0. Really, when you're looking at the release of hydrochloric acid in the body, hydrochloric acid gives you a pH of about 2. But when you add foods and things to it, it starts to dilute it and brings it up to that range of 3 to 5 in there. So that's where we're looking at more of the normal acid content of the stomach. Then we also look at an alkaline in the small intestine where the pH should be about 7, and these are the ranges in which the enzymes for that should be occurring.
And of course, the issue there is, yes, we do need an acid pH in the stomach, but as that food moves out of the stomach into the proximal end of the small intestine, it still should stay acid, but as it starts to move out of the proximal end into the distal end, it needs to turn alkaline. And many of the vitamins and minerals that people are taking are keeping them either in an acid state or an alkaline state. So you can tell if a vitamin is alkaline, it'll always end with an INE, alkaline. And so that's one of the areas that's so wrong in this nutrition business, where you got all these people running around being nutritional experts, and they don't have enough scientific basis to really know what they're doing. They're just listening to sales literature on television or that somebody's handing out to them and saying, oh, this is good, it'll prevent breast cancer. Well, what woman would not want to prevent breast cancer? Everyone. What man wouldn't want to prevent prostate cancer or colon cancer or liver cancer, or the woman ovarian or uterine cancer? Well, it's serious business, and this is what we're talking about here. So Dr. Jensen is going to go back to this now.
Okay, so what we're looking at is upon ingestion of foods and exposure to the acid environment of the stomach, calcium D-glucarate is metabolized. You can't but not change it when it's put in that kind of environment to D-glucaric acid. D-glucaric acid is further metabolized in the gastrointestinal tract. See, there's the change in pH. There's also, it allows for further metabolism of it. It's changed then in the gastrointestinal tract to 3 other compounds that are supposed to exist in equilibrium. 40% D-glucaric acid, 30% D-glucaro-1,4-lactone, and 30% D-glucaro-6,3-lactone. Those compounds are then transported to the blood and various organs and subsequently excreted in the urine as bile.
So if they're taking calcium D-glucarate and somebody hasn't analyzed their pH, isn't monitoring that,
right,
it's not going to work.
It makes it much more difficult for them to absorb it, and so it makes it much more difficult for them to absorb it from foods that may contain it. Okay.
Good.
So then, if we're looking at that, to give it to them in a supplement allows it greater accessibility for them to take that, as well as by supplying the correct enzymes or the pH for it, which should be tested first before you do that.
That's right. And they're not getting tested.
Somebody
say, oh, take this shotgun and we'll blast it at you and see if it works.
They could take this supplement and they take it and they're thinking, oh, I'm doing great for my body. But without monitoring it, it's just a feeling. They have nothing to back it up to say, yes, it's actually working.
Right.
So although D-glucarate-1,4-lactone is not commercially available, calcium D-glucarate is better in that its administration results in longer, which is 5 hours, inhibition of beta-glucuronidase than D-glucaro-1,4-lactone. Therefore, potential effectiveness, it must be taken every 5 hours. So we're talking about a sustained level of ingestion of this.
And we're not prescribing that for them.
No.
You need to talk to your nutritionally oriented healthcare provider to find out what's appropriate to them. We're just telling you what the scientific literature says.
Right. Like we said, we want this to take place under testing and monitoring guidelines for you. This is serious stuff. Treat it seriously. It is not a game. Okay? So therefore, for potential effectiveness, it must be taken every 5 hours. And the dosage will vary. The dosage will vary according to the laboratory findings in the organic acid profile. Even though it is a natural chemical, it should not be taken without prior laboratory testing. So then, glucuronidation. What is glucuronidation? Well, or liver detoxification, or even excretion of the xenobiotic compounds. Calcium D-glucarate assists the liver in detoxifying the blood and therefore is an anti-carcinogenic or has anti-carcinogenic reaction in the body. It assists the liver in removing carcinogens, excess steroid hormones, and other lipid-soluble toxins by conjugating them. So then, Dr. Lala, what are xenobiotic compounds?
What are they? I'll tell you what they are. They're terrible. They're absolutely terrible. They are man-made hormones and other chemicals that cannot be destroyed. They live forever. All of those hormones and hormone replacement therapy that women have been taking all of those years and the excesses that have been excreted by their body, guess where they are? They're still running around in our environment. So they go out in the rivers and into the lakes, and they're not cleaned out in the purification of water. And so then they go back into our soil, they go into our plants, and guess we're eating them over and over again, and guess what? They are never, ever destroyed, and it should be absolutely no question of why there's so much cancer in society, because they have created these hormones, these xenobiotic hormones, and they're killing us. Therefore, I would want to stay away from man-created hormones. So they continue, as the slide said, to circulate in environment forever. Now, Dr. Jensen used a word here that is called conjugation. What does conjugation mean? Conjugation is a chemical process that combines or pulls together, and there it is what Dr. Jensen was talking about. Then it transports those toxins to the kidneys for excretion. So I would want to do everything in my body to increase or enhance proper conjugation, just the way God designed it. So if those toxins, if those acids, if those hormones accumulate and remain in the body, they attach themselves to, guess what? Hormone-sensitive tissue, estrogen receptors tissue. And in the male, it's just down in the prostate. And so it's either in the breast, the prostates, the colon, or even in the skin. So many of the skin cancer problems we have today are really hormone-related, and they're missing the boat as far as diagnosing them. Now, conjugation of carcinogens, cancer-causing chemicals. When we influence the body and help it do that, when we assist the body and do that, this is what happens. It decreases beta-glucuronidase. It improves intestinal bacteria. So it decreases the bad bacteria and it increases the good bacteria or intestinal flora. It then rids the body or assists the body in reducing unneeded salts. It assists in lowering cholesterol. So if I've got a patient who has hypercholesterolemia, wouldn't I want to consider something like calcium D-glucarate? And it enhances enteropathic circulation. What does that mean? It's just hepatic means liver. So it improves circulation through the liver. Now, Dr. Jensen is going to talk about what is enterohepatic circulation.
That's a long word, isn't
But
it?
I did good with it.
You did great. So, the circulation, or what is enterohepatic circulation? It's the circulation of blood in the intestines and the liver. So this is stuff that's just coming from the intestinal tract, nutrients that are being passed on, and we want it to go through the liver right away to help cleanse it out before it goes to the rest of the body. It's important for cleansing and detoxification of the intestines and the liver. So the better that we can make that that circulation, the better off we're going to be with reducing the toxins that our body has to deal with. So then, what importance is this? There's another long word called tumorigenesis. Tumorigenesis, and what calcium D-glucarate does, it is an inhibitor of tumor formation. Now, before we were talking about how this helps passing along bile, and bile, a great deal, contains bile salts and cholesterol. And so by using this, it helps us to pass bile out of the system. Bile being made of those salts, if you pass it through the system, it gets rid of those salts. If it's made primarily out of cholesterol, it passes that out of the system and therefore lowers cholesterol, because otherwise what we tend to do is reabsorb it into the body and reuse it. And so what this does is it helps us just get rid of it in that regard. So it is, as calcium D-glucarate is an inhibitor of tumor formation in that it's getting rid of those substances, and therefore less toxification of the body occurs. Dr. Lawler?
A good question that we could pose is, why don't all oncologists suggest calcium D-glucarate? I don't know, but I know one thing is when I was just a chiropractor who focused solely on the spine, that's all I thought. You have that tunnel vision, just like a dentist has tunnel vision. A heart surgeon has that type of vision. Everybody has all these individual specialties, and that's really good. But as I saw, and the Lord expanded my perspective within the scope of chiropractic, within the scope of natural health care, I thought to myself, well, why don't they? Well, I want to tell you a couple things. One is insurance will often pay for the drugs of chemotherapy, but it wouldn't pay for a simple bottle of calcium D-glucarate. There's no money in it. There's hardly any money in it, so we don't have that motivation. Number two is that when I had this tunnel vision of spine, strain, sprain, whiplash, athletic injuries, that's all I could see. Well, then when God took the blinders off my eye and said, hey, if you intend to be a Christian chiropractic physician, you better start looking at my children from a whole person's perspective. You better start looking at each one as if they were Jesus Christ himself here on earth. Now, what would I do then if I looked at a person and said, my gosh, that's the temple of the Holy Spirit, the Spirit of the Lord? Would I say, well, let's just do chemotherapy or radiation? That can be helpful, so I'm not putting that down in any way. But would I then also begin to look at the nutritional aspects of that person by studying blood scans of their body, by doing some of the tests that we talk about? It just makes a lot of sense. So really, people aren't dying of cancer. What they're dying of is nutrition-related or malnutrition related to the cancer. So if we enhance and do everything we can, chemotherapeutically or radiation, if that's the route that the doctor wants you to go and you have a witness to do that, but we also influence to as much maximum natural health that we can, guess what? One is the cancer just might get cured. There's a possibility there. Number two is you just might not have to have as much chemotherapy or radiation. Number three is you may then be healed, or you may live a longer life healthy rather than die sick. Makes sense to me. Makes sense to anyone who will expand themselves beyond whatever blinders that they have on them. So now let's go and talk about breast cancer and calcium D-glucarate. Calcium D-glucarate is a combination of retinoids. You've heard about that, retinoids. Where do they come from? What is the first one? Vitamin A. That's where retinoids come from. And what are retinoids proven to do? They are proven, in addition to help your eyesight, they are proven to inhibit mammillary carcinogenesis. What does that say? Development of cancer within the breast. Isn't that interesting? Now, let's talk about another chemical that we talked about in a previous program, 1,3-C, or I3C, that means indole 3-carbinol. Where is it found? You see it right in the screen. If you don't have a television there and you're listening to us on radio or tape, it's found in rosemary leaf extract. So indole 3C carbinol with rosemary leaf extract assists the body in conversion of estrogen to the productive 2-hydroxyestrone. And in simple terms, when we do female and male hormones, that chemical is identified in our reports as 2-OHE. To the more potent, it converts it to the more potent 16A hydroxyestrone, and what do we see that is when it's abbreviated? 16-OHE, and that is a metabolite of healthy breast tissue. So I want to see in those 24-hour hormone analysis that we perform, I want to see good, normal, or above levels of that metabolite of 16A hydroxyestrone, because I know then that that woman has a much less or lower degree of propensity to breast cancer, and I know that it's affected when she takes calcium D-glucarate and or indole 3C carbinol, right? How about colon cancer, Dr. Jensen?
Colon cancer, calcium D-glucarate inhibits the azoxymethane, a chemical involved in colon carcinogenesis. Okay, so It's also inhibiting colon cancer from that regard. How about liver cancer, Dr. Lella?
About liver cancer, I mean, what is the difference if you have one M&M or half a package of M&M or a little piece of chocolate once every 5 hours, which will definitely predispose your body to diarrhea and all kinds of other stuff because it's a saturated fatty acid. It's a trans fatty acid in that candy. Now, you can pay money to do that, but then somebody says, why don't you take some calcium D-glucarate or indole carbinol, huh? It's going to be less expensive, but it's going to be healthy to your body. And if you're eating that candy once every 5 hours, and they say if you take it once every 5 hours, if you take the vitamins or the food supplement once every 25 hours, it's going to be, or 5 hours is going to be healthier for you. So I'm doing liver cancer now.
Liver cancer.
How about liver cancer? Calcium D-glucarate inhibits hepatocarcinogenesis. Isn't that interesting? How many people are dying of liver cancer, being diagnosed with liver cancer? Thousands of them. How many of them? And we see them, they call us, they talk to us, we see them as patients, and one of the first questions we ask, all right, what are they doing medically in their past medical history, getting all of that. Then we say, are you taking any food supplements? Well, I'm taking vitamin A. That could be harmful to the liver, too much vitamin A with cancer. Anything else? Well, I take vitamin C, and I'm taking some echinacea, and they're listing these things that they're taking, and we keep waiting for them to say, I am taking calcium D-glucarate. And hardly do we ever hear that. And they say, oh, really? My doctor never talked about that. My nutritionist never talked about that. My chiropractor never talked about that. The gal at church that sells vitamins, or the pastor at church that sells vitamins never talked about that. So again, we are destroyed for a lack of knowledge. Now, Dr. Jensen, or I'm going to get this one. This is good because I'm hot on this. Lung cancer. Lung cancer. Can calcium D-glucarate have any positive effects on lung cancer? You betcha, baby. You betcha. How? How? This isn't just some anecdotal information. Now, prove it. If you got something to say, prove it. All right? It inhibits what is called benzoapurines ability. That's a bad chemical, or a bad chemical. Its ability to bind to your DNA, your desoxyribonucleic acid, which then, if it does bind to it, it's going to induce pulmonary adenomas. Isn't that interesting? So, a person whose levels of calcium D-glucarate that are high have a less propensity to developing lung adenomas. Isn't that interesting? How about smokers? Well, we all know that smoking is bad, but there are a lot of people that know good things but still do bad things. All right? What about it? Could calcium D-glucarate help people who smoke? Ah, yes. Evidence suggests that calcium D-glucarate was found to be lower, 29% lower in the blood of smokers compared to non-smokers. My God, why would I want to keep sucking on those cancer cigarettes, on those cancer poisons, when I'm going to kill my body, do all kinds of stupid things to it? But then, why don't, if I am smoking, take calcium D-glucarate, or if I quit smoking, my God, they ought to consider taking calcium D-glucarate. All right, does calcium D-glucarate, does calcium contain calcium D-glucarate, Dr. Jensen?
Well, that's a really good question, because there's a lot of people out there, raise your hand if you're one of them, who's taking calcium. And you're wondering, well, calcium D-glucarate, that might be in my calcium, and I'm taking that. The answer is no. It doesn't contain calcium D-glucarate. We're talking about a completely different compound that is not found in the supplements of just calcium. The best source of calcium D-glucarate would be one that contains calcium D-glucarate specifically. You have to look for it specifically within there. This is one the supplement is calcium D-glucarate. Or eating large quantities of organically grown oranges, apples, grapefruit, or cruciferous vegetables. So if you take large doses of those or ingest a lot of that, then you may be getting a lot of that. And that's why they're talking about in all this anti-cancer research, to make sure that you have at least 5 servings of fruits and vegetables, because of the kinds of chemicals, the nutrient-rich chemicals within these things that help us deal with cancer. Is everybody getting that in? There's a lot of times when you start counting that, but in an American diet, this fast food type of diet that we're on, many times we just do not get in the amount of vegetables that we need to do, and therefore a supplement is a really good way of getting that while we are trying to change our habits so that we start to get in those servings of fruits and vegetables.
And it's never too late.
No.
It is never too late. So now people write us and ask us about inhibiting drugs or estrogen-related cancer, about tamoxifen and aromatase inhibitors, and Dr. Jensen is going to first talk about now tamoxifen. Now, if you've been prescribed tamoxifen, you listen to that oncologist. We're not in any way telling you not to follow any chemotherapy or radiation recommendations of your oncologist. But here are some things to consider. Tamoxifen.
Thank you, Dr. Lala. Tamoxifen, an estrogen-blocking drug used for 25 years for treatment after breast surgery. And then there's also aromatase inhibitors. Replacing tamoxifen now is recommended after breast cancer surgery. Aromatase inhibitors are enzymes that are active in endoplasmic reticulum or cellular activity, which play roles in conversion of testosterone to the aromatic, spicy odor compound estradiol. Estradiol is one of the members of the estrogen family, which include estradiol, estriol, and estrogen. Now there's catalysis. It is a biochemical process where the velocity or speed of a chemical reaction is increased or decreased. So if a woman's cancer is not estrogen sensitive, they do not use anti-estrogen drugs. Dr. Lala?
Now, what is it? Potential harmful effects of tamoxifen: increased risk of uterine cancer, stroke, and blood clots, does not prevent hot flashes or vaginal dryness, and increases vaginal hemorrhage. It also interferes with what are called neurotransmitters. Now, some of these chemicals also predispose that woman to osteoporosis. You need to really talk to your doctor and then go out on the internet where the drug company lists it, not the little stuff they're putting on the prescription that they hand you with your at the clinic. Now, I want to talk about one other thing here. If you've got a health problem, certainly it's good to follow good, solid medical advice. Certainly it's good to follow good scientific-based nutrition. But I would invite you, I would strongly encourage you, if you were my biological sister, I would encourage you to look to Jesus Christ as a great physician. I'm not talking about a religion or a denomination here. If you're in a denomination or a non-denomination, hallelujah. But the key is the great physician, Jesus Christ, because he is the healer. By his stripes you have been healed. That's in the past tense, you have been healed. And we need to feed that word to our spirit, our heart, so that when we go in there and we put a demand on God's word, that it is there. And if you haven't been doing that, that's fine. Get yourself involved with faith people who speak the word by faith and live by grace, for faith works by love. And that's the key.
The Fellowship of the Great Physician, through its School of Health and Healing, provides classes each Thursday evening. The primary focus of these classes is biblically based spiritual health and healing, with a brief teaching on physical health and healing. There is no charge or registration fee for these classes, but a free will offering is received. For further information on the School of Health and Healing, class time and location, or the topics discussed on today's program, contact us at the Fellowship of the Great Physician, in care of Dr. Lala or Dr. Jensen, at 200 Village Center Drive, Suite 100, North Oaks, Minnesota, 55127, or telephone us at 651-484-8521.